previous vaccination effort. We're going to be throwing everything at it in order to ensure that everyone eligible is offered that booster in, as I say, just over 2 months. Across England, we'll have more than 1,500 community pharmacy sites, all of extra hospital hubs on top of those already active. There'll be temporary vaccination centres popping up like Christmas trees, and we'll deploy at least 400 military personnel alongside. I know the frustration that we all feel with this Omicron variant, the sense of exhaustion that we could be going through all this all over again. But today I want to stress this is taking some proportionate precautionary measures while our scientists crack the Omicron code, and while we get the added protection of those boosters into the arms of those who need them most. So we're going to get behind the men and women of our NHS who've saved so many lives on the front line and run our vaccination program for a year almost without a break, as they have, and who are going back into the breach yet again. And our country, a thank you to each and every one of them for their extraordinary. We can all show our gratitude is by doing our bit and stepping forward when our time comes to get that booster. I've been waiting patiently for my moment to come, and it's happening on Thursday, I'm pleased to say. So and to do the same. It's time for another great British vaccination effort. We've done it before, and we're going to do it again. And let's not give this virus a second chance. Thank you very much. I'm going to hand over to Sad.
This week, this country made headlines when we became the first nation in the Western world to authorize a vaccine for COVID-19. This kicked off one of the greatest collective endeavors this nation has seen in peacetime. And think, right across the UK, and a booster program that is expanding at a phenomenal pace. Today, we've hit that milestone of 18 million booster doses across the UK, and the daily number of jabs has gone up a third since the start of this month. The country, with the exception of the USA and China. And that is something that we can all be very, very proud of. And I'd like to thank the NHS, the armed forces, the volunteers, and everyone who's done so much to make this program a success, as well as every single person. Weaken the link between cases. This is the real world protection that our vaccination program provides. Boosters, in particular, play a very huge antibody response than the primary course. We're now dealing, of course, with this new variant, Omicron, which the World Health Organization said just yesterday. They said that it poses a very high global risk. Confirmed cases in Scotland, and we expect to see these numbers rising over the next few days. There's a lot we don't know, of course, and our scientists are working on the variant and what it means for our the time. Everything we can to slow the spread of the virus and to strengthen our defenses. One important secured hundreds of thousands of doses of 2 antivirals that have the potential to speed up recovery. Another, of course, is that vaccination program. It's true that we're this new variant, but although it's possible for them to be less effective, it's unlikely that. So the best way that we can strengthen our protective wall is to get as many jabs in arms, our independent expert advisors, to look urgently of this new variant. And as the Prime Minister just set out, we'll be massively expanding booster doses in line with the JCVI advice. This includes expanding the booster doses to include all for acting with such speed in response to this potential threat. This means we're now able to put our booster program on steroids and protect even more of our vaccine throughout this pandemic. And today, we are setting out our plan to get those jabs into arms, and we'll shortly be hearing a bit more from Amanda. We've set some hugely ambitious targets, and we're asking a huge amount from the NHS. But I have no doubt that they will rise to the challenge, just as they have done throughout this pandemic. I know that the developments of the past few days have been worrying for some people, and that we've brought back memories. What we're seeing recently has brought back memories of the strain of the last winter. But although we have one huge advantage, this virus at bay. But these defenses will only keep us safe if we use them. This is a national mission, and we all have a role to play. If we want to give ourselves the best chance of a Christmas with our loved ones, the best thing we can all do is step up, roll up our sleeves.
So yesterday afternoon, the government accepted the JCVI recommendation to accelerate the NHS COVID-19 vaccination programme in response to the potential threat from the new Omicron variant. That's why I am writing to the NHS, setting out the steps we need to take to operationalise this new guidance. As we've just heard, JCVI have advised the gap between the second dose and the booster should be halved from 6 to 3 months. This means an additional 6.9 million for a booster. And on top of this, again, as we've just heard, JCVI has recommended the introduction of fourth jabs for those who are most vulnerable because they're undergoing chemotherapy or have other problems with their immune system. The programme was already in its most complex phase, and staff are now working at breakneck speed to respond to this, the biggest challenge in the biggest change in eligibility since the programme was launched. In line with protocols and patient group directive are put in place, we will continue to vaccinate the millions of people who were already eligible. Back to the NHS, we will let you know when it's your turn to take up the offer. It is our intention to ensure that everyone eligible for a booster is given the chance to book one before the end of January. To make this happen, we will need to expand vaccination capacity right across the NHS. Hundreds of hospitals are, of course, already jabbing their own staff. We're now workers already offering jabs to the public through the national booking. We're looking at how we can help them to do even more jabs by cutting other burdens on them to free up clinicians' time. And we will ensure that they are properly rewarded for their efforts, particularly when they take time to visit vulnerable, housebound. Payment for standard delivery of vaccinations will increase to £15 a shot until the end of January. To increase, agreed to continue their pause on routine inspections of general practice to help free up clinicians' time. And we're also looking at whether we can safely reduce or even eliminate the 15-minute wait after the jab is delivered, so we could potentially increase the number of people able to get But to help make it quicker and easier to get a jab, local areas will also particularly given the other pressures facing NHS staff who are working extremely hard. They're working hard to address the backlogs that have inevitably built up in less urgent care, while hospitals cared for more than 500,000 people with COVID as inpatients, and of course many, many more in the community. They're working extremely hard to deal with the rebound in demand for urgent emergency care. And of course, they are working extremely hard to care today for those thousands of patients in hospital and in the community with COVID. However, as the world faces this new threat, we can take confidence in what the NHS has achieved so far. Next week, we mark the first anniversary of the world's first Pfizer COVID-19 jab delivered here in England by the NHS. 1 year on, the NHS COVID-19 vaccination programme is closing in on 100 million jabs administered in England of booster vaccinations in North Yorkshire. Of course, the success of the NHS vaccination programme has not been down to health service staff alone, but the result of a huge national effort. Since its launch, we've been supported in particular by our amazing volunteers and many other partners. As we launch a renewed drive to protect our country, we're working with our colleagues at RVS and St John 1,000 paid vaccinator roles. So if you are able to help, then please do apply or volunteer your help in a generation event, and we all have a role to play. I am confident that with public support, the can-do spirit of the NHS will once again win through. On behalf of all NHS staff, I would just like to thank everybody who's taken up the offer of a jab, and urge again everyone watching to keep up their enthusiasm for this programme by accepting the invite for each of the jabs available to you when it's your turn.
Thanks very much, Amanda. Let's go to questions from the public first. Alex from Surrey asks, given that the Omicron variant spreads more in crowded and unventilated spaces, why are you not expanding the face covering requirement to higher risk indoor settings such as cinemas and theatres, given these settings are of greater risk than shops and transportation? Well, Alex, thank you very much for that. And that's a question that's been asked a lot in the why aren't we doing face coverings all over the place? And the answer is that we're trying to take a balanced and a proportionate approach, Alex, slowing down the spread of Omicron while we get to the bottom of the exact effect that it has. But Saj, anything you want to add on that?
No, that's right, PM. And of course, we keep all this under review, but we still don't know enough about the variant to understand properly its spread compared to Delta. But as we learn more, we will certainly share that.
Thank you. Tanith from Surrey asks, given the concerns of the Omicron variant being more highly transmissible and possibly bypassing the vaccines, what is the government doing to protect those designated as clinically extremely vulnerable, especially in those who are immunosuppressed, in which the current vaccines do not have the same efficacy as in, say, a normal healthy person who is not immunocompromised? Saj, I think you touched on that earlier on.
Yeah, one thing I can certainly share with Tanith and all those listening is that the antivirals that we procured, the way the antivirals work, the two I mentioned earlier. So we've got 730,000 courses already. One of them has already been approved by MHRA, our independent regulator. I think we were the first in the world to approve it. And because they work in a very different way to the vaccines, we're confident that they would provide a high degree of protection. And of course, the priority for those antivirals will be those that are clinically extremely vulnerable.
Great. Thanks very much, Saj. And thank you, Tanith. Let's go to Vicky Young of BBC News. Vicky.
Prime Minister, one of your top health advisors suggested this morning that we should all minimise our socialising over Christmas. Was she right to say that? Do you agree with her? Do you think that we should be cancelling Christmas parties right now? And to Amanda Pritchard, can the NHS, we know there's a lot of pressure, especially going into winter, can the NHS really cope with what is a massive expansion, really, of this vaccine programme? And to the Secretary of State, what more can be done to persuade those who haven't had any vaccines at all? We're, of course, talking today a lot about the booster programme, but we do know that particularly in hospitals, a large proportion of those there have not had any at all.
Thanks very much, Vicky. So the answer is no, the guidance remains the same, and we're trying to take a balanced and proportionate approach. And as I explained on Saturday, when talking for the first time to everybody about Omicron, we're really dealing with two variants at the same time. We've got the measures in place to fight Delta, which we think are appropriate, and then we're bringing in some tougher measures to stop the seeding, the rapid seeding of Omicron in this country, to give us the time we need to get the boosters in, and of course to find out more. So those measures, as you know, are the tough measures at the borders, the PCR test when you arrive, quarantine until you've got a negative result. That contacts for anybody who comes into contact with an Omicron case also has to quarantine. I think that's the right balance, and we will keep it, of course, under constant review. And I should say, of course, we've got tougher measures, even tougher measures for travel for those countries, for those 10. Is that it? I think that was it. Good. Thank you. Let's.
Well, to Amanda about the NHS.
Oh, sorry. Go on, Matt. Sorry.
Thank you. So, look, I think there is absolutely no doubt that this is the most complex part of the vaccine rollout programme so far, and NHS staff have done, I think, an incredible job. They've stepped up every time there's been a change. You're absolutely right to say there is significant pressure. I've mentioned some of the pressures on urgent emergency care, as well, of course, as continuing to try and deal with some of the backlogs that were inevitably created across the last 18 months of the pandemic. But was we're expecting this to be a difficult winter. But last year, let's not forget what they achieved, stood up to the second massive increase in COVID cases, began that life absolutely all the stops to do the right thing for their patients.
Absolutely right. So, Emily Morgan of ITV.
Prime Minister, should people be taking your advice or the advice of one of your scientists to get through all those who are eligible? How are you going to do it by the end of January?
Well, first of all, make sure that you have good ventilation and wear a mask when you're in a confined space, with up the regular. We still, the most important thing is we still think that your best single protection against all variants is to get 48 hours later. So,
Do you want me to go,
yes, Amanda, go on.
So, look, thank you. It is our clear intention to ensure that everyone who is eligible has a chance to book that booster by the end of January. In order to achieve that, I've set out a whole range of things we're going to be doing. There's no maximum to the number of jabs that we're aspiring to give a week on week, but what we do need to recognise is, this is going to build up over the next few weeks, and inevitably there will be things that change and adapt. Vaccination programme, but the range of things that I've set out does mean that we have confidence as we stand that we will be able to make sure that all of those people who are eligible will have that opportunity to book.
Great, thanks. Ben Kentish, LBC.
To meet that target by the end of January, you need about 30 million doses. Could you just confirm that European countries have advised asking when this is all going to end? Obviously, we know it's not imminent, and the Omicron variant raises a lot of uncertainty. But can you give people some hope that the day when we won't have to wear masks, we won't have to test or quarantine, when restrictions can be lifted, is that still the case, or does Omicron set that back? Thank you.
Thank you. I think, Amanda, you're first.
Well, look, thanks to the outstanding work of the Vaccine Task Force, I am reassured that we absolutely do have the supply we need.
Yeah, on the face coverings, we have there's already guidance on face coverings, including the types of face coverings that are recommended, and there's some 5 million people throughout the UK that haven't even had one jab, and they really are putting themselves in harm's way and their loved ones, and we really urge them to come forward. And it is right also, when you look at hospital admissions, that it's a disproportionate number of people that haven't been vaccinated. Sadly, for example, if you look at all the pregnant women that are in hospital because of COVID, almost every single one is unvaccinated. So
$1 million question or $1 billion question, whatever. To new protection, every variant of protection of some degree. That's why it's so absolutely vital to get the boosters. But we need to check that. We're waiting to see what the science that we think they are strictly necessary for the protection of public health. Jason Groves, Daily Mail.
Thanks. Mr. Jebbard, you said, I think there's now 13 cases. Do you think it's likely that we are now seeing community transmission in England and the rest of the UK? Ms. Pritchard, could you tell us a little bit more about what the troops responding to the news they're seeing by cancelling Christmas parties, scrapping nativity plays? Would you urge them to think again and get this in perspective?
Yeah.
First of all, on cases, the cases that we identified at we're not able to say whether or not at this point, was we don't know. We're doing that work right now at speed to determine whether they all have a link to South Africa or not. Is there likely to be community transmission? I think we have to be realistic. There is likely to be, as we're seeing in other European countries. And also, as I said earlier, that we would expect cases to rise as we now actively look for cases, because now having so and searching for these cases and taking action, of course, if they find them.
Thanks.
Thank you. So the NHS has had brilliant support all the way through this programme, whether that's from volunteers or from the military or partnership with a whole range of other community groups and local government. So, once again, we will be working with the military in a range of ways, everything from kind of support logistics through to actually coming forward as a volunteer through the whole of the last year, and really will be again. And I know that the incredibly dedicated staff who are working in the NHS really value the support that they get from that volunteer workforce and from those wider partners.
Thank you. Yes, and Jason, just on your point about Christmas parties and nativity plays, we think that what we're doing is trying to take a balanced and proportionate approach to the particular risk that is posed by Omicron, focused in particular. We think that's the right way to go for the time being, until we know more and until we can get more. Cameron Chileshi of the FT, please.
I just have a couple of questions on the new restrictions. So with the changes in the self-isolation rules, businesses in particular have warned of a second pandemic with potential disruption to staff. But can you confirm whether contingency measures are being placed, say, for example, for work at home, for work from home measures ahead of Christmas? And can you rule local restrictions. For example, if there's a surge of cases in one particular pocket of the country, for example.
Thanks very much, Jasmine. So just on the risks of going back to where we were in July, of cases of Omicron are small, but we'll have to see, and we'll have to keep that keep that constantly under review. On the having as far as you possibly can, moving together is the a middle question.
It was just that the government has ruled out Plan B, but
sorry, yes, well, look, thanks, Jasmine. We haven't ruled out anything. I've got to tell you, I think another lockdown of the kind that we've had before is extremely unlikely. I'll be upfront with you about that. But we, against the Delta variant, we think that it's basically been going numbers of admissions to hospital and a decline in the number of deaths, and that's the crucial thing that we've been following. So at the moment, we see no cause to move to Plan B, but as I've said to you many times, to deal with Omicron are as I've said, distinct. Last to Joe Mays of Bloomberg.
Prime Minister, just to press on the work from home point, Scotland, Wales and Northern Ireland are all advising to work from home if people can. So what is your reasoning around the harms of working from home, and why do those harms outweigh the public health benefits that could come from significantly reducing transmission of a potentially dangerous variant? And just briefly on migrants, how do you plan
to Jasmine that we have in place to deal with coming down? We now have a particular issue to deal with the seeding of the potential seeding of the new Omicron variant, and there what we want to do is focus particularly on tough measures at the borders. We're also doing something to stop transmission by reintroducing face masks in some settings, so continually. The reason for not proceeding approach that is proportionate and balanced and suits the needs of the present risk. And of course we will change things as necessary, but what we're looking for is the first real reassurance that we need that the vaccines are efficacious against this variant. Even if the efficacy, the effectiveness is reduced, it's still very important to know that whether they're effective and its effect on the north of the of the country. And I just want to say how the government, I'm extremely sympathetic to have seen that electricity now restored, but clearly for 50,000 people, that is not good enough. And I want to reassure everybody that we're working grid and everybody else. It must be a very, very tough time for those homes that are currently without power. And I'm afraid that is all we have time for. Thank you all very much. Thank you.